Yeah, good morning, everybody, or good afternoon, or wherever you're at. Today, I'm just going to cover, just like Christoph was saying, I'm just going to cover spatial computing in spine surgery. This is part of a larger talk, but we'll go through it quickly here and hit the highlights that are important to you guys. I have no disclosures, which is amazing. I've lasted this long this way, but we'll go through a little bit on each one of these, but really what I'm going to focus on is not so much education, but I'll focus more on planning because I'm sure education will be covered more by Dr. Goldman. But I'll go a little bit into planning in the intraoperative world and a little bit on the patient experience end. So in the education domain, the only thing I wanted to bring up is that there is going to be, you'll see the dissection master and all these other things later on because Dr. Goldman will talk about it, but I want to plant the seed in your mind that there is going to be eventually an atlas where we get to have a centralized repository of virtual reality RXR surgeries. And I think that is an important view or vision into the future that you have to keep in mind, that as you're training, it would be really nice not to just watch a video, but in 3 dimensions, be able to experience the practice surgery in VR and then experience the 360-degree actually recorded surgery for different pathology types. And I think that is an eventuality. So, and specifically for lower middle income countries, subspecialization is difficult there with fellowship training. And I think that would be a nice way beyond YouTube. On the planning end, where I'm a little bit more focused, just as a general idea, in spine surgery, we have this very complex organ we operate on that's made up of multiple vertebrae, 33 vertebrae, and you have to keep the head over the pelvis. So we have all this great software that helps us align the spine. This is an example of something called SurgiMap. We have to do bony cuts. We have to plan and removals of discs. We have to plan a lot to be able to get the spine loose enough to move it. And these surgeries can be up to, the shorter surgeries are 4 hours. The longer surgeries can be 12 or 16 hours. So any advantage you get really helps. We know that using virtual reality in spine surgery, we know that it decreases OR time. We know it decreases blood loss. We know it decreases the hospital stay. And we know it increases the satisfaction for surgeons. This is something that we've had since even Google Cardboard. In the world of pre-surgical planning, this is an example of just a quick example, not to play the whole video, but a quick example of
with an axial CT cut demonstrating.
Can you guys hear that audio? Let's see here.
We'll rotate to a coronal cut.
Demonstrates I'll turn off the audio here. So this is an example of us taking a black and white CT to start with, using Medicalholodeck to get a nice windowing of it and be able to take a look. And this is not even a CTA. This is just a general CT that's not even optimized for virtual reality. This is a patient that's had a previous fusion, and I can identify the discs through the psoas muscle, which is the muscle that lays upon the spine. And I can identify each individual disc. I can get an idea of where in the muscle belly I'm going to enter to get into each one of these discs. And then you can see the calcifications in the blood vessels there. I can see the discs between the two blood vessels there. So even though I'm not a vascular surgeon, it gives me insight into another specialty to understand, if once I get the vascular surgeon involved, I'll be able to plan the incision for them and plan the approach to get down to the disc. Here I'm measuring off of a place where I can feel on the patient's body, the hip bone, and then measure out to the disc and say, okay, if I'm generally within 8 centimeters basically of that area that I'm palpating or touching, the incision is going to be around the disc that we need it to be at, which is the L5 and S1 disc, the bottom disc there, the spine. I'm going to push this preoperative model away now, and I'll show you here the postoperative model. Those purple areas are the areas where I was able to fit a graft into the spine using Medicalholodeck for planning. And then you can see the rod is much longer now. We've corrected the curvature of the spine. And there's the graft that we were able to place after planning 8 centimeters off the hip bone. And you can see, I can even measure angles inside of Medicalholodeck. I can see that my lumbar lordosis there, or the curvature of the lower spine, is about 54 degrees. And then here in the preoperative model, it's about 40 degrees. So we're able to get a 14-degree correction after a pretty short time frame planning inside of Medicalholodeck. You can see that the CT on the right side is a little bit higher fidelity. But there's a lot of room for optimization, not just in the AI space and in this software in particular, but in general as AI pushes forward, and specifically open source protocols like Model Context Protocol push forward. I can see a future where there is MCP or Model Context Protocol servers that call into Medical Holodeck and do all this in an automated fashion with you, and the AIs help do all this planning for you automatically. So that's an exciting future, to say the
We will
least.
stop.
So let's cover this one here. Sorry, I'll pop back to my original slide. It's a complex presentation. The next thing I want to show you very quickly is how I can use Medical Holodeck for CT and MRI merger. And this is a hard and elusive concept. I think only a few companies have this capability, like Medtronic, for example. But here on the left, you can see this patient's got a significant spine fracture. I mean, that I think anybody doesn't have, you don't have to be a radiologist, you can just see that and say that's terrible. On the right, that's the correction we were able to offer them after having cement placed in there too. So this is a very difficult surgery. The major question I had in my mind was, where's the spinal cord compared to the bone? So when I'm drilling, I can get a better idea of how the spinal cord is folded. Well, this is an example of me taking the MRI out of the spinal cord and placing it inside of the CT scan, and then being able to wave in and out of it with Medical Holodeck to get an idea of what that bony fracture looks like and what that spinal cord looks like in a folded fashion. And you can see that little fold there approximately at the very, very tip of it there on the left side in the spinal cord. So that kind of information is really invaluable. I mean, we protected somebody from being paralyzed because I know this information ahead of time, right? So I don't. The problem with the world right now is there's so much noise that you can have something as revolutionary as Medical Holodeck, and it all comes down to how big your megaphone phone is and how good your funding is. And that, unfortunately, that's a strict limitation for how we can push forward revolutionary technologies. But this is one of them. That's the key point I want to drive home. The other thing is, like Dominique said, I use AI, the total segmenter and AI the AI package to count vertebrae and count levels. So inside of here, it accurately counts mid-thoracic spine, all these very hard areas to really be sure of. This automatically counts it for me, and I can automatically go to the operating room, and I'm confident, oh, I know the exact 3D terrain. It's kind of like looking at a satellite image and knowing a mountain or knowing a city really well, just having a bird's eye view, like a 40,000-foot view. Medical Holodeck offers me that. So I have a bird's eye view of the bone and where the bones are exactly and where they play a role before I even walk into the operating room. I mean, the people who operate with me are always shocked that I'm able to touch a bone and tell you which bone it is, because I've memorized the 3D contour. I know when my finger touches it, oh, that's C4 for sure. It has an upside down Nike sign as its spine is processed. I can just feel it, and I know what it is because I saw it in 3D in Medical Holodeck first. So not to take up too much more time, but the other thing I want to bring up is in the future is we need VR-specific radiology protocols. Eventually, we're going to get to a point where radiologists are fully bought in and their protocols are specified and perfect for the ideal fidelity in VR. And that's what's going to allow these inputs that Dominique was talking about to allow even higher fidelity in what we see in virtual reality. As far as the intraoperative world is concerned, we have a lot of revolutionary technology right now. Eventually, we're going to have loops, and we're going to have these, like the glasses I'm wearing right now, for example. I don't know if you can tell, there's a little screen at the top of them. These are augmented reality glasses that I wear day in, day out. We'll eventually have injections inside of here that are SVGs or vector graphics that allow us to do navigation without even having to look up from the surgical field. I mean, the Medical Holodeck is going to play a large role in being able to implement these outlines and automate them in conjunction with AI. So these types of loops can be used intraoperatively as well. I see that future coming. And the other thing I want to bring up very quickly is this is the way we did it. This is how we did it before Medical Holodeck. We'd have to go and 3D print a multi-$1,000 model or a multi-$100 model and have legendary surgeons basically review them right beforehand. So on the patient experience end, there's a lot of room for virtual reality to play a role here. And I'm just sharing this just so you have a better vision, is when it comes to patients, we know that if we show them their pathology in virtual reality, they have an objectively higher comprehension of what they're about to go through. And in my field, spine surgery, the recovery time periods can be up to 6 months. So I really need every advantage I can get to show patients what they're going to go through. And this is something that I also see Medical Holodeck playing a large role in. And then even the strangest thing, we know patients that have Terrible pain. If you put them in virtual reality, it's an analgesic and helps reduce their pain. I can't explain that entirely to you from a psychological or psychiatric or neurologic perspective, but we know that there's value in places we don't even see yet. So that's an important thing to keep in mind. Um, Overall, I hope this is a quick. Teaser, basically, of explaining all the different ways we're using virtual reality in spine surgery. The only thing I want to highlight from this slide is that we do have a good understanding of post-operative evaluation of the construct in virtual reality, like I just showed you in that video. We do now have telemetry, meaning we have smartphone apps that tell us how many steps a patient's taking, how well they're doing after spine surgery. So that's data, that's outcome data that's very objective, that we can correlate with the plan we did in Medicalholodeck. So we can even optimize with that data which surgeons offered the best plans for which pathologies as examples of what other surgeons should learn from. So that's coming too. And finally, the end goal here is we're going to build foundational models and frontier models to help prevent complications in surgical patients. That's what the underpinnings of Medicalholodeck is going to play a role in, and automating robotic approaches eventually. So what they're building, what they're doing plays a huge role in all the future roadmap of what we're seeing in spine. And it's honestly been an honor and a privilege to work with you guys for, I think, 6 years now. So it's been a pleasure. And that concludes my talk. Thank you so much.